Hello and welcome to 6 Minutes. I'm Michael Woodhead. Well, it's July and the government's GP after hours helpline is now up and running. It's a nurse triage phone line that will offer callers health advice and, if necessary, put them through to speak to a GP. The service may also refer patients directly to an after hours service for a face-to-face GP visit or advise them to go to a hospital. It's being run by Medibank Private, who already operate the Health Direct phone advice line. Health Minister Nicola Roxon was at their offices in Sydney this week to launch the service, and this is what she had to say.
Well, the sad truth is over the last decade we have seen the number of GP practices that provide after-hours service dramatically reducing. So we need to encourage people to continue to provide, as GPs, decent after-hours service at their practice, but we can then provide backup through this service so that in the middle of the night, where it's not practical for every GP practice to be open, that there can be a doctor on the end of the phone who can provide advice. That means we're going to have more people reassured that they don't need to take urgent action, quickly aware if they do need to take urgent action, and of course then feeding back to your regular GP if that's something that a patient or caller wants. So I think there's good opportunities. I've seen a lot of supportive comments from the AMA, I've seen some other critical comments. That's really part of the course when you're doing health reform, we expect that. But I think consumers across the country will be very pleased that this is now an enhanced service that they can access by telephone from their own home. I don't think it'll have any dramatic effect on deputising services. This can enhance those services. Again, there's a particularly busy period for deputising services in those sort of still sociable after hours rather than the very unsociable hours. We want to make sure that we are enhancing their work, not replacing it, because there's always going to be the need for face-to-face services. And this call actually is a way of being able to triage who needs those services and who doesn't, and I think it'll be able to support and back up the work of deputising services.
We've had great success recruiting some very experienced and dedicated GPs to our service. They're all looking forward to being able to deliver this sort of care under this new model. We have all the appropriate safety checks and balances in place to make sure that it's an effective, timely and safe clinical outcome for all people. And we once again appreciate the opportunity to be part of this leading edge technology.
And we are pleased that as a government we're able to say now to more people across the country that they can, when their regular GP is closed, access advice which helps them know whether a health issue should be one that's acted upon or can wait until your regular GP is open the following day. A great advance, and of course we're excited about the further potential from the 1st of July next year where video conferencing will be added to this call service.
Well, there will be more changes ahead for GP after hours services when Medicare Locals take over funding in 2013. But that's all for this week. Thanks for watching. I'll see you next time.